Thank you for staying awake, and it shall be my endeavor to keep you awake. Okay? Now, what I talk to a large extent for people who already have balance, laboratories in their clinic, it may be redundant, but I hope there would be some take-homes. But for people who are starting, this is my perspective, and I want to be extremely, not falsely humble, honest, that this is my perspective. I have tried to set up balance labs, so I have some experience in small centers, in teaching hospitals. So I have developed a certain formula which I'm sharing with you. Extremely limited in my objectives. Take home what you feel is interesting from it. Yeah? That's all. Fine. So first and foremost, why do you want to set up a clinic? Now, generally in life, whether it is conferences or anything which you want to do, it has been my observation, and permit me this, 60 years of experience, there are hidden reasons and there are open reasons. The hidden reasons could be whatever you want, the open reasons are what you talk about. Say for the hidden reason is, I want to make money, or I want to be famous, I want to stand here and give a talk in front of everybody. The overt reason is, I want to serve humanity, I want to do all that. Now, what I found about this Vertigo lab is you can achieve both. So you don't have to stress yourself. You can achieve whatever is covert, you can achieve whatever is overt, and therefore really it's a win-win. Let me explain why. See, how do I go back on this? Okay, I'm talking about the previous slide. If you can make money, nobody really minds it, provided they get some knowledge in return or the patient is happy. So you can actually do both. This is a wonderful way of both serving and achieving your covert objectives. So how do you go about it? You go about it first by thinking of money. Now there are various ways of raising money. You can either do it yourself, take a loan, etc., etc. But for those of you all who work in institutions, you have to learn how to sell this idea to the administration. Many people who work in medical colleges want to do it, but they say, people don't give money, they don't consider. I want you all to realize that if you learn the tricks of selling like you would do in private practice, you should be able to sell it to the manager that, look, you put in this much money, I can make this much money. Now, this has nothing to do with vestibular lab, but this is the critical point. But if you can't sell this idea to your management, they will not buy you the equipment. You can't set up a vestibular lab. Extremely important. You need to train. You know, you won't believe it, in 80s when I entered this field of ENT, we would be struggling to find books to explain concepts. We had only one or two, Scott Brown or some unreadable books in the way. Now there are so many ways of learning. You can go conferences like this, you can go YouTubes, you can hear Halmaigi himself describing his procedure. What more do you want if you have the originator describing his procedures, if you go to YouTube videos? So what do? You find space. Now, most of people who work in cities will realize how difficult space is, because space costs money. In medical colleges, you have to kill somebody to create space. In private hospital, corporate hospitals like this, it's war. But you have to create space. One, you have to set up equipment. What I personally like about the balance eye equipment is it doesn't take much space. But you have to get equipment. You cannot do without equipment. You can't do the kind of vertigo analysis we did in the 80s, which was largely manual and visual. You have to employ people. These are not one-man shows. If you are the chief cook and bottle washer, the volume you can do is less. So you must factor in employments, and you must regulate them. You must make sure that what they are doing is proper. I'll return to this in a while. You require two types of instruments. Some instruments for inducing nystagmus, rotatory chair, optokinetic, etc. These are ways of inducing nystagmus, because when the patient comes to you, there is usually no nystagmus. You require instruments for recording nystagmus. This balance eye is one of them. The cuteness about that is, I'm not marketing, I'm just saying is that you get both almost together. You get the TV screen and this thing, you get both the method of stimulating and the method of recording. You need to think about the other aspects of the vestibular system. Now, the next point which you must realize is you must sort out documentation. There's no point in saying, I had a patient unless you have documented. Those of us who worked with electronystagmography will know how many cases of things you have missed because all you have is one long graph. I've had analog graphs which fall down on the paper. I had postgraduates who sabotaged it so that they didn't have to do work on it. But now that's solved thanks to having VNG devices. We've tried to help sort out your documentation woes. This is in beta mode. So this will now be added on to all your software of the balance eye. So we've done an exhaustive data capture system, which goes automatically, is digitized and will help you in the next stage. You must research. Now I know I'm giving another talk on research, but I can't help but say that if you set up a vestibular lab with documentation, as I have suggested, you must research because it is the logical next step. Now, here I'm giving you the covert reasons. The overt reasons is you must help science, you must help this and all that. But actually the covert reasons is it helps you get noticed. I mean, who's standing out here? Only the people who have done some research. The others are sitting down there watching these people and they're thinking, hey man, I've done cases like this. I've done 10 cases. He's talking about one case. So come here and share. Now, you can't share unless you've documented. We are trying to help you document. Take the logical next step. Research is basically asking questions. I will allude to that tomorrow. If you all are still awake tomorrow, I'll be able to tell you in detail how to go about it. But it gets you noticed, it gets you fame, it gets you fortune. And of course, it is the purpose of the profession to continuously improve both your results, and therefore you need to do it. So you must do it, but it's also very, very beneficial. So your documentation is not only clinical history, it is also imaging, video, and I honestly feel you don't know how lucky you are. I've been through the phase of struggling where we had no imaging, no documentation, and most of these Vertigo conferences, this crowd is here largely because you have a method of documenting and sharing. The ability to get references also is now so simple, and here we are trying to help you in your process of getting references. That also I will share with you tomorrow. You must audit your results. See, I think it is time for India to wake up and realize that the reason why the West does not listen to you is we are not talking outcomes. We are only talking, I did this surgery, I did this, I did that. The West has left that behind because it is no more ego. It is how effective is this procedure. For that, you should start outcomes. So what I told you was we should start research and all this stuff is the first step. Why are you doing all this? You want to find out whether you're benefiting the patient. You're putting intratympanic gentamicin. Is the patient better or is he more vertiginous? You say, no, all my patients are cured, but all your uncured patients have come to me, and vice versa. So I think we all need to start thinking in terms of outcome. We all need to mature because our competitors now are international. Our competitors are no more within your city or within your state or within your country. Your competitors now are international. It's a competitive world, and we are good enough. Actually, we are good enough, but how would you know if you're good enough if you don't have your results, if you can't stand up and speak? So I think I'd urge you all, especially the youngsters, to stop comparing. See, you're all smarter than me, so you don't have to compare yourself with me. You are smarter than me. I certify you as smarter than me. You now have to compete with your peers all over the rest of the world, right? And you can compare notes with Dr. Alfargal and ask him, how smart are the Egyptians? Come, let's share. And you'll find that they're smart. They're smart. And I have friends who are from Egypt. They're really smart. And they have good equipment. And they benchmark. See, the trick about being smart is your benchmark is what is important. The Indian cricket team is doing well because it benchmarks itself internationally. The Kabaddi team and all that benchmarks itself only with Asian countries. And therefore, it will not be really good. You understood what I'm saying? So start benchmarking yourself internationally. How many of your publication goes in index journals? And I don't mean predatory journals, in actual impact factor journals. We should all start thinking like that. You need to interact with other specialties. No man or woman is an island. You need to learn to interact. Most of your cases will come from other specialties. You have to prove your worth to the neurosurgeon, then he refers his case to you. So start working, all of you youngsters, start interacting. Even if your boss doesn't, you do it. You need to attend conferences, that stands to reason. No, what I'm trying to tell you is setting up a vertigo lab is not an act in itself. It is the beginning of a continuum of research, of conferences, of growth, publications, and we're trying to set up a system by which we can help you publish, we can help you do the writing up, we help you do the analytics. All this you know, I don't have to tell you this, but I'm pushing you to think beyond just setting up a lab. You need to join associations, and where associations don't exist, you need to make them, but you have to realize that alone you can do only this much. As a group, you can do a lot more, provided you use associations positively. If you use associations as playground for practicing politics, you will only reduce yourself. If you use associations as a method of working together, you can only grow. And take help. I mean, quite honestly, I'm very happy with taking help. I mean, I see so many of they call themselves my students, but now I think they're my gurus. And if I have a case with tricky this thing, I know if I have a laryngeal problem, I call Shantanu. If I have, cochlear implant thing, I call Sunil. So it's all about using help. And you have an excellent resource. Srinivas is, I don't know, Ustad in vertigo. I've seen him fiddling around and trying to do circuit boards, soldering and everything. He knows MATLAB software. I only know that MATLAB software exists. He knows it. That's great. I mean, I'm amazed at the gray matter available, not only in India, all over the world. But we have not started using it. You see, in my generation, my bosses were all about controlling. I mean, their job was to control. So you have a horse which is very energetic, it's pulled back. I would urge all of you all to start adopting a different approach and work by using the word encouraging. So even when you set your own clinic, if you encourage, you get encouragement in return. It's called paying it forward, and it usually comes back and helps you. So I hope I've been able to stimulate you a little. Those of you all who don't have a vertigo lab, you can do it. Don't see it as just a lab or setting up how many square feet, etc. See it as a continuum of your professional progress. And to those of you all who have already set up a lab, encourage you to move on a little further. And if we have done that, I think the Cyclops team in Balancei has done something for the society. And I'd be very happy to have that as a take home.